Minute brought to you by St. Francis Health, serving our community for 111 years.
And welcome back. Well, more young people are now being diagnosed with cancer, and one kind in particular for young men. Mandy Gaither explains.
He's an Ohio State University sophomore and a proud member of the Buckeyes marching band. But last semester, Grayson Nemi knew something wasn't right with his body.
Some soreness and just enlargement, and then eventually feeling a lump like while showering.
At first, Nemi says it was thought to be a cyst, but an ultrasound and further testing revealed the lump was something else. Testicular cancer, and the disease had spread. He was just 19 years old.
And it was definitely just scary, especially with the type of cancer I had. It can impact reproductive health.
It's estimated that about 1 in 250 men will develop testicular cancer in their lifetime. For the most part, it affects young and middle-aged men, with the average age of first diagnosis being around 33 years of age. But about 6% of cases happen in children and teens.
These guys are usually healthy. And so I think what the message should be is if you see something, say something. If something's abnormal, let somebody know.
Nemi's medical oncologist, Dr. Paul Monk, with Ohio State's Comprehensive Cancer Center, says early detection of diseases is always important. Symptoms can include a painless lump or swelling in a testicle, change in size or shape, a feeling of heaviness, or a dull ache in the lower abdomen or groin. But there is effective treatment, and because of that, Nemi is back out doing what he loves. He's now cancer-free.
If there's a symptom, definitely get it checked out as quickly as you can.
For Health Minute, I'm Mandy Gaither.
This